Now, the Ghana Health Services has confirmed 580 new COVID-19 cases as of 30th July 2021. It brings the active caseload to 6,278. Of that number, 86 are severe and 17 critical. Volta, Bono and Bono East regions are emerging as COVID-19 hotspots in the country. The case rise in these regions has significantly increased since July. Director of the GHS, Dr. Patrick Kumar-Boaje, who was given an update on the country's case count as a briefing, says most of these cases were recorded in schools.
Where is matched to your passport, and that's when we get to know who is positive or who is not positive. Once you are positive, the system again retests, and then you are sent down to a holding room where there's a doctor there and a nurse who will give you a triage to see this person who is positive, what situation. Is he sick? Is he symptomatic? Does he have any other comorbidity that is of relevance? And if they cannot do that, because especially in the evening when they are there, we have nurses in the hotels where they will do that. They are then transported to the hotels. And so far we have about 6 of such hotels, 6 or more of such hotels, all around the airport area with a negotiated package for people to pay for. Like we said, those carrying Ghanaian passports are offered the Ghana Isolation Center at Pantine. That is, if you opt not to go there, then you have to now decide to pick a hotel where you pay. The hotel is a package that includes your accommodation, meals, and etc. And then you go there, and these are negotiated prices that are relatively low compared to what their charges really are. And then there's a nurse there who checks you up and makes sure everything is fine. And then, of course, the second test is done on the 3rd day, and then on the 7th day there's a repeat test. If you are negative on the 3rd day, you are discharged. Then you have to wait till the 7th day. If you are still positive, you wait till the 7th day. In line with our protocol, that is making sure that you do not leave the place able to shed the virus. We are convinced that after 7 days, you are not able to share the virus, and so even if you still remain positive, you will still allow to go unless you fall sick at the place whilst your condition changes, for which you'll be transferred to the hospital for management of the case. So basically, that is the flow. So there's no challenge. Yesterday, after testing nearly 1,800 or so people, we had 3 positives. But you can also see that how sensitive it is. As you see the global trends go up, you also see the surge at the airport. That tells you that it's really reactive to the prevalence of the virus. And so we have a lot of confidence in the system, and we will continue to apply the protocols as it stands until such time that, and as I mentioned the last 2 weeks Wednesday, there are even more stricter protocols by other countries, but we are able to. So all countries have them, but we need to understand that this is a virus that has a different character, and so all protocols are geared towards limiting importation into the country. This is not to say that is 100% proof that nobody will come through, because somebody may be incubating at the time and test positive. And that's why we even tell those who are positive to, as much as possible, to self-isolate, wear their masks, because they could turn positive. For those who have come from countries that we have determined as a current hotspot, we follow them up on the 3rd day to check them up and see whether they are still okay. And for those who are found positive, those sitting around them, we also follow them and do contact tracing on them to be sure that they have not been able to pick the virus along the way. So basically, that's what I can talk about as far as the airport is concerned. But I'm sure if there are questions behind, I will be able to answer. So I can now go ahead with the presentation of the current status. And the next slide, yes. The current situation is that as at the 1st of August we have confirmed a total of 106,434 cases. And I'll give you the further analysis of that. And that the total tests done is 1,449, 1.49 million tests. There were 98,814 recoveries, and we have so far recorded 854 deaths. And you can see that we started this problem with about 817, so you can see how far, how many people have done. Our current active case is 6,766, and this is quite worrying. So that tells us that in the last few weeks, we have increased, our active cases are increased from 1,600, that's in the last 1 month, to over 6,000 in 1 month. There's been a very steep rise in the active cases in the last 2 weeks. We have increasing hospitalization and deaths. We are having some emerging hotspots outside Accra and Kumasi that we know of. That is now we have Volta having new cases. Bono is also sharing some cases. We also have workplace and school outbreaks taking place. We also have seen, as all of you are aware, that still there's a total disregard to the use of the face mask by the general population. And unfortunately, the Delta variant has become the main dominant variant currently as we speak now, especially in Greater Accra region where we've done extensive work. The next slide. So you can see that from the curves that you are seeing, the third wave is on its way up, and we hope that we work, and we all of us, not just the health sector, including the people, will be able to avert this by applying the protocols and adhering to all the protocols, including acceptance of contact tracing, cooperating with contact tracing, and isolation, so that we can bring these numbers down. So, if you look at the 7-day moving average in the next slide, you can see a steep rise. In the second wave, we are very approaching where we peaked in the second wave. But it's an opportunity for us to work very hard to start reversing this by simply applying the very protocol that has worked for us over the years, over the months, the first and the second wave, to be able to bring this down. The general hotspots still remain, as we speak today. Accra is deeper, then followed by Ashanti region. And then you have the other regions. Now we're seeing Volta, color is getting deeper. Eastern, Central are also showing increasing number of cases. When we come to Volta region, we've seen a lot of few more schools there getting an outbreak. That is also influencing the numbers they are getting. If you look at our active cases, you can see that the chart there is quite steep now. Very steep. The last second wave, we peaked at about 8,000. And if nothing is done urgently, in the next 1 or so weeks, we might just cross the 8,000 mark. So there's a lot that we all need to do to avert this. This has also shown in our hospitalization. Currently, just in Greater Accra alone, we have 272 persons on admission because of COVID. 36 of them are critical. Severe cases are 87, and about 149 are mild to moderate. There are always this, you can see that there's a steep increase in the number of critical cases, making it difficult for the case management team and affecting our ability to provide ICU beds for the teeming number of people who currently need one. I've talked a bit about the airport already, but beside the discussion on the flow and the challenges that have been raised and that have been cleared, as at 7 a.m. on the 4th of August, we've had a total of 2,407 cases which represent about 0.59, about 0.6% of all those who have been tested at the airport. That tells you that about 99 plus of all the people who test are negative, and that is in reflection of our prevalence. Majority of them are males, 63% and 37% female. The usual numbers have not changed. About 4 out of 10 are Ghanaians and the 6 are non-Ghanaians. And this includes Ghanaians also carrying foreign passports.